Good afternoon, everyone. Welcome to Project First Line refresher training on transmission-based precautions for EMS. We are going to begin shortly. We have the pre-session survey link on chat right now. This is a requirement for continuing education. So if you haven't already, and if you'd like to, please feel free to go ahead and fill that out. It takes about 2 or 3 minutes. And we will begin very shortly. Thank you. Hello again, everyone. Good afternoon and welcome to Project First Line Rhode Island's transmission-based precautions refresher session for EMS colleagues. And welcome back to those who previously attended our refreshers. I see some of you are here. Welcome back. And for those who are with us for the first time, welcome to you all. On behalf of Project First Line Rhode Island, thank you for your presence and for all your work in our community. My name is Karina Descartes. I'm the Project First Line Rhode Island team lead. And it's my great pleasure to be hosting this training for you. Apart from our lead training for this session, who is a seasoned nurse clinician for over 3 decades in many different care settings, we have our subject matter expert in emergency medicine who are joining us today. And before I invite them to introduce themselves, I'd like to invite you all who are participating in this webinar to introduce yourselves as well. If you feel comfortable, you can type your name, what your role is in your organization, where you're coming from in Rhode Island or elsewhere in the country as you join us today. And while you're doing that, I'd like to welcome other members of our team who are also here in support of this webinar. Abby Anderson is currently behind the scenes and she will be connecting with you all on chat. And now I'd like to invite Dr. Alexis Kearney and Lisa Ledoux to introduce themselves.
Hi, everyone. My name is Alexis Kearney. I am the Consultant Medical Director for Project First Line Rhode Island. We worked on this project with Eric, whose photo you see on the screen here today. So just so you know, this was done in conjunction with his office as well. If you could take a minute and just finalize your training, your pre-survey trainings. The link was available in the chat. If you need it, please let us know. This is how you will get continuing education for your participation today.
And hi, my name is Lisa Ledoux. I am the Project First Line Infection Prevention Liaison and Training Liaison, and I will be presenting this course to you today. As Karina mentioned, I've been a nurse for 30 years. I have acute care, pediatrics, ER, clinical educator, home care, and some management experience. So I do understand some of the EMS world from my nursing experience, but most of my knowledge also is being married to a firefighter and medic. So I am happy to be here today. I thank you for joining me as we go through this refresher session on transmission-based precautions.
Thank you, Lisa, Dr. Kearney, and Eric. For those of you who are just logging in, you are logged in at the Project First Line Rhode Island's transmission-based precautions EMS course. And for our agenda, today we have done our introductions and we will begin this refresher with Lisa walking us through the learning objectives. Then we are going to review the 5 elements that cause infection. We're going to talk about pathways of infection, SARS-CoV-2 transmission, and then we're going to focus on transmission-based precautions and then considerations surrounding an emergency pre-hospital call. We'll dive into some case scenarios, very brief announcements, I swear, very brief. And then we'll invite back in Lisa and Dr. Kearney for our Q&A. And then before we conclude, we'll request for a quick feedback vote from you all to help us improve on our future sessions. The Center for Acute Infectious Disease Epidemiology and Center for Emergency Medical Services under the Rhode Island Department of Health, as well as the CDC, are partners in support of this session. And we are about to begin, but first, some useful reminders. Everyone is muted at this point except the training team. If you look at the bottom bar of your Zoom app, you will see the Q&A box, a chat box, and a hand raise icon. For the Q&A and discussion at the end of this session, please use the Q&A box to send your questions or use the hand raise button to be unmuted. If you have any questions about what is being discussed at any point, feel free to type them in the Q&A box and we will field them for a Q&A as mentioned later in the session. Please use the chat box to type your email if you wish to be included in our email list for updates. And today's session is being recorded. And now here's Lisa to begin our session.
Thank you, Karina. And again, thank you all for joining me. So the learning objectives for this course will apply to any EMS call, whether it be a pre-hospital call or a transfer call. The first objective, we're going to review the 5 elements of how germs spread and cause infection. Second objective, we're going to review the type of organisms and the modes of transmission while performing an EMS call. We're going to discuss how these organisms can spread from surfaces to people, from surfaces to other surfaces, and from person to person. We're also going to be able to understand the ways SARS-CoV-2 moves between people and its mode of transmission in different spaces. The third objective We're going to review how to prevent potential transmission of these organisms during an EMS call. Fourth, we're going to review COVID precautions. We're also going to review source control, as well as standard precautions, enhanced barrier precautions, and transmission-based precautions. And last, we're going to discuss how you can apply your understanding of transmission-based precautions as we go over a few clinical case scenarios that you may have encountered in your practice. EMS is definitely more than a ride. EMS systems provide an essential service in response to emergencies. These last 2 years have reminded us how important EMS clinicians are, especially in a time of crisis. EMS workers could be any of the following: emergency medical technician, emergency medical responder, advanced emergency medical technicians, advanced cardiac emergency medical technicians, paramedic, firefighter, nurses. So these EMS titles may vary from state to state, but they're all critical to public health, safety, and also infection prevention and control. During the COVID-19 pandemic, EMS clinicians helped keep people out of the hospital by evaluating them in their homes and at nursing homes. In some areas, EMS workers administered vaccines and treatments for COVID-19. Some even staffed the ERs, some medical facilities around the country, all while putting themselves at risk of infection. As you all know, EMS providers are the front line of medical care and have a high risk of exposure to patients with known or unknown infectious disease or germs. You don't know what you're going into, right? On your calls, you have no idea what you're walking into. And the emergence of multi-drug resistant organisms such as MRSA or VRE has presented major problems facing healthcare providers, including EMS providers such as yourselves. You want to be ready every day for every kind of emergency. Unlike patient care in the controlled environment of a healthcare facility, EMS workers come across unique challenges in respect to infection prevention while caring for or transporting patients. And it's usually due to the nature of the setting, enclosed space during transport, frequent need for rapid medical decision-making, interventions with limited information, and a varying range of patient acuity along with healthcare resources. So it's very important that EMS personnel are provided education and training and frequent refreshers, such as this webinar, on prevention of infectious agents to maintain their safety and the safety of the people that you're taking care of in the community. So we're going to begin and just review a little bit about germs. Germs are part of everyday life, and they're found in the air, soil, water. They're in and on our bodies. Some germs are helpful while others are harmful. Many germs live in and on our bodies without causing harm, and some even help us stay healthy. Only a small portion of germs are known to cause infection. So we're going to go over the next few slides, the 5 elements that contribute to the spread of germs and how they cause infection. These are the 5 things that contribute to making someone sick. All 5 need to be present and to cause infection, to cause that person ill. Germs need to survive in the environment while they spread, and they need to be able to cause that infection while they reach somebody. They need germ survival. They also need a person. They need an individual that they can infect. Germs also need to get around the body's defenses and infect them. Some examples: if a person is already sick, their immune system could be weak and not able to fight germs easily. Or if their skin, which is normally a barrier, it becomes broken because they have an IV inserted. Germs can easily enter the body through that break in the skin. Germs also need a place to live. We call these places reservoirs. Essentially, they're like their habitats. There are 4 reservoirs that can be found in the human body: the skin, the digestive system, the respiratory system, and the blood. There are also 4 reservoirs that can be found in the environment: water and wet surfaces, dry surfaces, dirt and dust, and devices. And last, germs need a pathway because they typically can't move on their own, or at least not very far. Germs need a way to get from where they live to another person or place. The pathways that germs can travel are through touch, breathing in, splashes and sprays, and bypassing the body's defenses while receiving clinical care. We're going to break down some of these pathways in just a bit. But first, I'd like you to join me and invite you to participate in this poll question. What elements are needed to cause infection? A, host; B, transmission; C, reservoir; D, breakdown of defense; E, germ survival; and F, all of the above, or G, none of the above. So if you could please enter and put your answer there. Give you a little bit more time. Okay, and excellent job. The answer is F, all of the above. Okay, so we just reviewed the 5 elements that can make someone sick and cause infection. Now we're going to review the pathways of these germs. Pathway refers to the way germs are moved to that susceptible person. Germs don't move themselves. They depend on people, the environment, and or medical equipment to move in healthcare settings. And again, the ways that they can do this are through touch, splashes and sprays, breathed in, and clinical care. This image depicts the 4 common pathways for infection to spread. If you look at the top of the image, you'll see contact, droplet, and airborne. That was the traditional framework. At the bottom, as I just named off those 4, that is the current model of the 4 pathways. So it's important to know when looking at this model that certain germs can fall into one pathway, multiple pathways, or even all of them. Pathway touch, it can be direct or indirect. Direct contact transmission occurs when there is physical contact between an infected person and a susceptible person. It occurs when microorganisms are transferred from one infected person to another without a contaminated intermediate object. An example, touching during a handshake or taking a pulse on a patient or even performing CPR. Indirect contact involves transfer of an infectious agent through a contaminated intermediate object. So there's no human-to-human contact. And some examples of these objects can be patient care devices, such as cardiac monitors, blood glucose monitoring devices, your stethoscope. These all may transmit pathogens if the devices are contaminated with body fluids or blood, and they're shared between patients without cleaning and disinfecting properly between patients. What about the backboards that some of you are using? What about those safety straps? Are those cleaned properly? The stretcher, cell phones, writing tablets. I mean, you touch so many objects in just one EMS call if you think about all that you touch. And here are some common organisms that can be transmitted via touch. C. diff, Ebola, strep, staphylococcus, MRSA. Scabies is not classified as an infection, but it is a highly infectious infestation that is transmitted via touch. And the next pathway, splashes and sprays. The pathway of sprays and splashes occurs when respiratory particles or body fluids travel from an infected individual to another. These particles carry infectious organisms that can reach your eyes, your nose, and your mouth. No matter what the disease is, if it transmits through splashes and sprays, the greater the distance from that infected individual, the lower your risk of transmission. These germs can travel farther if propelled by coughing or sneezing. And here are just some types of organisms that can be transmitted via splashes and sprays. Haemophilus influenza, whooping cough, mumps, or even Legionnaire's disease. And here's the pathway of breathed in. It's when smaller infectious particles can be breathed in. These are very small particles that carry infectious organisms, and they can remain in the air for a long period of time. They also have the potential to reach further distance. So some examples of some organisms that can be transmitted by breathed in are meningitis, tuberculosis, measles, chickenpox, and of course, we all cannot forget, which is still out there, is SARS-CoV-2. The last of the 4 pathways is clinical care. Clinical care can bypass or break down the body's natural defenses. These actions can potentially be complications from a medical intervention, things that you and I, all of us do to take care of our patients. The cause of infection can be due to a medical intervention, an error, or even negligence. We obviously are not intending to harm any of our patients. None of us do. However, unintentionally, these infections can occur by some actions and some care that we provide to our patients. Some examples, inserting an IV. You're bringing germs right into the open skin if not performed under proper technique. Or if a patient became infected because a healthcare worker failed to wash their hands after touching a previous patient. CPR is a clinical intervention that a lot of you perform daily. And you, as the provider, you're at risk. This life-saving process can cause the transmission of infection. During CPR, providers are prone to pathogen exposure through all of them, touch, splashes and sprays, breathed in, clinical care. I know there are only a few cases of infection transmission to rescuers, that have been attributed by performing CPR, but that risk is still there. And here are some some organisms that spread by clinical care. We've got E. coli, Pseudomonas, Streptococcus, Enterococcus. So let's go to our second poll question. So again, I invite you to participate and answer if you'd like. The four pathways or modes of transmission for infection to spread are through A, touch, B, splashes and sprays, C, breathed in, D, clinical care, E, all of the above, or F, none of the above. I'll give you all some time to put your answers there. Excellent job. The answer is E, all the above. Super. The COVID-19 pandemic has taught us that transmission of infectious organisms does not always necessarily fit into the structured categories that we once considered. We're next going to discuss more detailed the transmission of SARS-CoV-2. We've come to understand the transmission of this virus falls more under a spectrum of pathways, and it's dependent on the size of the particles being emitted, the amount of time these particles remain suspended in the air, and the environment or physical space you're in. We now have learned that this virus may fall anywhere on the spectrum, and the type of transmission depends on the situation. So COVID-19 can be transmitted by breathing in, which is the primary mode of transmission. It could also be transmitted by sprays and splashes, or it could be acquired while in a setting receiving care. And in some rare circumstances, as we've learned, SARS-CoV-2 can be transmitted via touch. Again, that's the rarest circumstance. An aerosol generating procedure, such as the nebulizer, produces many small respiratory particles, and that falls closely to the breathed in spectrum. Sneezing is another example. Sneezing produces much larger respiratory particles that falls more closely to the splashes and sprays category. So our understanding of SARS-CoV-2 transmission has developed and changed over the course of the pandemic, and it's surely going to continue to do as we learn more about this virus. Based upon how we know germs spread via a pathway or pathways, this helps determine the type of precautions we need to take in our practice to protect ourselves. Next, we're going to watch a 4-minute video from our CDC Project First Line's Dr. Abigail Carlson explaining source control and how it relates to your practice.
Welcome back, everyone, to Inside Infection Control, our video series here at CDC's Project First Line. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you with us. We have talked in previous episodes a lot about the different actions that we can take to keep germs from spreading, in healthcare in particular. And source control is one of those important actions. But what exactly is source control? It's a concept that we come back to a lot because it's that important, and it starts, not surprisingly, just like its name, at the source. You're stopping germs at the source before they can spread to other people. We talk about source control as an important tool for COVID-19 to reduce the spread of COVID-19 and other diseases that travel in respiratory droplets. And we're going to focus on that today. But keep in mind, source control is important for a lot of other diseases too. One example is shingles. We cover the spot where a shingles rash is, which keeps virus from getting from the rash into the air or onto other surfaces in your environment where it can spread and it can infect people. That's source control for shingles, covering the rash, the source. In COVID-19, source control focuses on covering the nose and mouth to keep your respiratory droplets out of the air, because that is the main way that the virus that causes COVID-19, SARS-CoV-2, gets from person to person. Masks that fit snugly around the cheeks and our chin are the main way to do source control for COVID-19. A mask that fits well covers your nose and your mouth and blocks those respiratory droplets which are traveling in the air when you breathe and which have virus in them if you're infected. This means that those droplets, when they're covered up with that mask, are much less likely to reach other people around you and then infect them. And if you're caring for a patient with COVID-19 and you're using an N95 respirator and not a mask, Most N95 respirators that we use in healthcare are also good at blocking your respiratory droplets from breathing out into the air. So with most N95s, not only are you protected from the virus that your patient is breathing out, but your patients and your colleagues, if you're infected with any virus, are protected from germs that you might breathe out. All of this source control is important for COVID-19 because we don't always know who's infected. Other source control methods, like in the shingles example, depend on knowing that the patient is infected and knowing what to do. For example, covering a wound because you've seen it, you know it's there. COVID-19 is different because we have patients who are asymptomatic, which means they can be infected, but they may not show it yet, and we may not be aware that they or we, if we're infected, can spread the virus to others by talking, breathing, singing, and other activities that use our breath. We'll talk more about this in another episode, so please stay tuned for that, because asymptomatic transmission, asymptomatic infection, it's an important thing. But this spreading of infection when you don't have symptoms, it's one of the biggest reasons we have everyone wear a mask that fits well when they're in the healthcare setting, and also when you're out in the community. So you can see why source control is an important tool in healthcare and in the community for stopping the spread of COVID-19 and other diseases that travel by respiratory droplets. As always, thanks for joining us. Please be sure to follow up with us on Facebook, on Twitter, we're on YouTube, and of course we're on the web, cdc.gov/Project First Line. We will see you back here for the next episode.
Okay, thank you to Dr. Carlson. So let's recap on what we've learned so far. We've reviewed the 5 elements that can cause germs to spread and cause infection. We reviewed how infectious organisms are transmitted and the 4 types of pathways. We just heard about source control with Dr. Carlson. So let's continue and review how we can protect ourselves, our patients, and our coworkers as we care for our patients during an EMS call. Standard precautions, they are the basic practices that apply to all patient care, regardless of the patient's suspected or confirmed infectious state. These practices protect and prevent healthcare personnel from transmitting infections to other patients. Think of all of your patients as potentially infectious. No matter how emergent you feel the situation is, and you've been in many urgent situations, all of you have stories, but adhering to standard precautions and donning PPE is critical. But here are some of the infections that are prevented with standard precautions in the healthcare setting. Just to name a few, we've got hepatitis, HIV, Staphylococcus, Streptococcus, varicella zoster. Standard precautions are frequently where healthcare providers can get complacent. We are busy, so that those extra few minutes to wash your hands more thoroughly or donning the appropriate PPE can seem very time consuming. These are very, very small steps, but they make a huge difference. And as healthcare workers, we have an obligation to our patients, our coworkers, and our families to maintain standard precautions for infection control while caring for our patients. So I'm just going to go over these briefly, but it's important to definitely review these standard precautions. Hand hygiene. It's the most critical protective measure against cross-contamination in the healthcare setting. Unless hands are visibly soiled, an alcohol-based hand rub is preferred over soap and water in most clinical situations. Use of PPE, proper personal protective equipment. Wear gloves whenever there is a potential for contact with blood, body fluids, mucous membranes, non-intact skin, or even contaminated equipment. You don't want to wear the same pair of gloves for that, taking care of other patients. You know, 1 pair of gloves per patient. Don't use the same pair for 2 patients. Wear mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of body fluid. For some of you who have been in my other webinars here, I like to just always tell a quick story from some of my clinical days. So I know all of you have tons of stories, but this one always sticks in my head. I knew a medic who went on a call for a woman complaining of abdominal pain, fever, general malaise. He arrived at the house. She was in pain, lethargic, no active vomiting, no diarrhea. She agreed to go to the hospital to be checked out. They got her in the ambulance, hung the IV fluids. This medic goes then reaches over to go get another set of vitals and her blood pressure. And at that time, she projectile vomits. So to avoid getting into too many graphic details, her vomit may or may not have gone into his mouth, but it definitely went all over his face. And obviously he was not protected with face shield, goggles, or a mask. All of his mucous membranes were exposed. The long end of it is, thankfully, this medic was, went through the PEP protocol and everything turned out okay, thankfully. But in that type of situation or that call, would any of you have thought to put on or have that PPE available? Also think about some of your patients that you've cared for that have gone unconscious, woke up and had projectile vomiting. So I want you to always have this in your mind and just to always protect yourself and be ready, right? Remove PPE before leaving a work area. Respiratory hygiene and cough etiquette. Cover your mouth and noses when sneezing or, coughing into your elbow. Using tissues and disposing of them properly after using them. Hand hygiene to follow. Also, safe injection practices. EMS providers are known to have risk of sustained needle injuries, needle stick injuries. Obviously, it's accidental, and during IV insertion or obtaining a finger blood stick, you're at risk there. As I mentioned earlier, logically, really, why would you be at risk for it? Well, the emergency of your work. You're working at a very fast pace. The urgency of completing that task. What about that ambulance? You're going 60 plus miles per hour, going around curves and bumps and all that. So sharp instruments can act as a source of cross-contamination if not used properly or even disposed of properly. If the instrument is disposable, healthcare providers, you want to assure that safety cap is on and it's placed in the approved disposal container. And so important, but so simple, and we still see it. Do not recap needles after using them. Clean and disinfect environmental surfaces, your cell phones, the defib monitors, door handles, stretchers, including those safety straps we spoke of, disinfecting tablets, your phones, any writing utensils, I don't know if you use styluses or pens, whatever you're using. Clean and disinfect contaminated surfaces in the ambulance, such as the walls, the ceilings, the cabinets, handrails, with all approved cleaning agents. What about laundry? Some of you might have, laundry services where you're stationed at, but if you are going home with your work clothes on, how do you wash them at home? Do you keep them separate from your family? And also waste management. It's produced for a procedure. It must be disposed of properly. If the procedure, what if you had saturated, linens with blood or body fluids, anything like that, or any dressings, anything like that. You want to make sure it does not go in the traditional trash, that it goes in the proper waste management disposal bins. Adhering to all these help protect yourselves, your patient, and any future patients that you're caring for. When standard precautions alone can't prevent transmission, they're supplemented with transmission-based precautions. So this is a second tier of infection prevention. So remember, transmission-based precautions are always used in addition to standard precautions for patients with known or suspected infections. And this may look familiar to some of you, especially if you're transporting somebody to or transporting out of a acute care setting in a hospital. Most of these are seen in inpatient rooms. You wouldn't see them really down in the ER. Maybe some of you have, depending on the ones you've been to. But this is the classic division of transmission-based precautions. So the terminology contact, droplet, and airborne, they're only used in reference to precautions, okay? The yellow is contact precaution, green poster is droplet precaution, and the blue poster is airborne precautions. Another thing I could recall, a scenario I could recall is when I worked at Cape Cod Hospital. I remember a private ambulance service coming to transport a patient off my floor to a nursing facility. And this patient, was on contact precautions for C. diff. I reviewed with the medics that this patient has a highly infectious C. diff and that a gown and gloves are recommended. And one of the EMTs did wear the full proper PPE and the other one just wore, gloves only. And I bring this up to you just as a reminder, we could all educate each other, right? And help each other in our daily practice. I'm here today to deliver to you infection prevention training and the most up-to-date recommendations for infection prevention and also infection control. I want to empower you with this knowledge to allow you to protect yourselves and your patients. And this, some of you may have seen this poster. It's the Enhanced Barrier Precautions. And this was an updated guidance from the CDC this past July of 2022. It applies to nursing home patients, so you wouldn't see this in a hospital. These are precautions that are, again, used for patients in a long-term care facility who have wounds or an indwelling medical device, or can have a MDRO, a multi-drug resistant organism, such as MRSA or VRE. This precaution includes use of a gown and gloves during high contact with this resident. So if any of you are transporting a patient from a skilled nursing facility to a hospital, always check to see if they're on an established precaution. See if any of these posters are outside of the patient's room. So you want to always be aware and be prepared. If that patient does have a multi-drug resistant organism, if they have an indwelling catheter, so that these precautions may possibly be in use. So I think most of us by now know that SARS-CoV-2 is a very unique virus, since its transmission doesn't fall just into one category. And you will see here that we've referred to COVID-19 precautions to describe specifications that healthcare providers like yourselves need to take to protect from this virus. We now know that depending on the situation, SARS-CoV-2 might be transmitted via splashes or sprays, breathed in, clinical care, or rarely by touch. The precautions that we will highlight in the next slide are inclusive of the specific understanding of how COVID-19 is transmitted. These precautions cover all possible scenarios in the spectrum. As you can see, contact precaution, droplet precaution, and airborne precaution. And then also it could fall in between the droplet and the airborne. In this slide, you'll see over here, there's in the chart, it's the PPE recommendation for all healthcare workers in respect to COVID-19. So patients with suspected or confirmed SARS-CoV-2 infection, all healthcare workers want to wear a gown, gloves, eye protection, N95 or higher level respirator. This recommendation is for all community transmission levels if there is a suspicion of confirmed SARS-CoV-2 infection. CDC recommends that healthcare providers use N95, being that it offers the highest protection, along with eye protection, gowns, and gloves, depending on the situation. Patients without suspected or confirmed SARS-CoV-2, they're in the low and moderate community transmission level, which is the blue and the yellow, and only source control is recommended. So remember, we just learned about source control with Dr. Carlson, stopping germs at its source before it spreads to others. We don't always know who is infected. And then in the substantial and high community transmission level, which is orange and red, the healthcare worker will use eye protection and source control. So moving on, I want to share with you how you can look up your community level of transmission. This is the COVID data tracker. And Abby is going to show the link on how you can go to this. This is how you will find out in your state, in Rhode Island, or wherever some of you live. And you could also narrow it down to the community you work in to see what the community transmission level is. So when you go to this tracker, you want to always make sure that you click on transmission levels, which is highlighted in the red. And then you will scroll down to the map. Sorry about that. There we go. You'll scroll down to the map. And again, you want to make sure that the data type and the map metric are community transmission. And then you can click on the map where you want to check and see what the levels are. And how the community transmission level is calculated by two metrics. They take a record of the new cases per 100,000 persons in the past 7 days. And then they also take the percentage of positive tests during the past 7 days. And this data is updated weekly, just so you know. So this site's up to date once a week. On the left-hand side, you will see that's an image where I clicked on Rhode Island, and then I hovered over Providence County. So that's where you can see where it's a deeper red there. And it indicates high community transmission levels, which I'm sure none of you are surprised at. We are in a high level. And then there's a correlation to the right there with the recommended PPE for the healthcare worker. So it goes by the color, the legend there matches up to what is the recommendation for the PPE for the healthcare worker to utilize. In the next 3 slides, we're going to briefly touch upon things to consider what PPE to utilize, and what precautions to maintain during a response to a call, during transportation of that patient, and also post-transport. When you arrive at a scene, you need to think quickly and be prepared for anything, right? It's important for you to gather as much clinical information as you possibly can in such a short period of time. And as EMS personnel, you want to be vigilant in gathering info such as travel history. Anyone living with this person, have they been sick or have they traveled? The onset of symptoms. Are these signs and symptoms possibly of a communicable disease? Is there fever, cough, GI symptoms? You want to use standard precautions and add appropriate transmission-based infection precautions whenever you gather information and as you learn that you possibly need extra protection with what this patient is telling you. And when responding to any medical situation, EMS workers must ensure they are properly protected. They must always wear proper PPE when treating all patients. And again, in many cases, wearing your N95 and your safety glasses can help prevent infection. If able, if possible, while transporting this patient in, can you put a mask on the patient to contain droplets if the patient is coughing. Involve the fewest number of EMS personnel on the ambulance. So you want to minimize possible exposure to others. Family members and other contacts should not ride in the ambulance if possible. And when possible, use vehicles that have a separate driver and patient compartment that can provide separate ventilation to each area. Close the door and the window between these compartments before bringing the patient on board. And again, effective communication as to where you're bringing this patient. So whatever your procedures are, whether you're entering it into the clinical system, your computer system, or however you are communicating with the accepting facility, you want to give them heads up on what you're bringing in and a potential exposure to COVID, or it could be anything, RSV cases. And post transport, hand hygiene. A lot of EMTs, medics, can really effectively wash your hands when you get to your destination, right? You're using the hand gel, which is fine, but you want to make sure that you do wash your hands effectively after transport of your patients. You want to dispose of your PPE properly. Utilize appropriate containers for the red biohazard and sharps container. And you want to remove all contaminated clothing and follow the procedure and protocol of your laundry. Remember, when you're taking if you're stripping down the stretcher and it's got body fluids or something, as you're disposing of that, remember to keep that away from your body when you put it into the bin. And disinfect equipment, emergency vehicle, clean the vehicle out per your protocol. We're now going to go over 3 different scenarios. Please participate, and you could type in any of your comments along the way. I'd love to hear from you. The first scenario is a patient who calls 911 for abdominal pain, including nausea, vomiting, and diarrhea. What are some considerations you have, and how will you protect yourself during this call? So if you want to participate and just put some answers in the chat box, please feel free. If not, we will definitely go over it in the next slide. So some considerations. Could this be C. diff? You want to consider if it could be a highly infectious C. diff, which can be, it's not going to be diagnosed at the scene, right, at that time. So therefore, it's critical that you are properly removing and disposing of your PPE, because C. diff spores can live on surfaces for months. Could this be COVID-19? COVID presents with nausea, vomiting, and diarrhea in a lot of patients, which is not something we really think about. Is this patient going to require an IV? Most likely this patient will require an IV for hydration. So what equipment are you going to use for this patient? IV fluids, an emesis bag. And I like some of the comments you guys have put. This is great. How long have they had the symptoms? Exactly. N95 gloves and mask, eye protection. Fantastic. And the precautions you would use, contact and droplet precautions. And also, because COVID's still in the landscape, you would still be using COVID-19 precautions. And as some of you already said, the PPE, you already know you're going to be wearing gloves and masks, but there are additional items to have on hand, and prepare yourself for what you might be walking into during that call. Like we said, eye protection and a gown. Remember the story I told you about that medic? You don't know. You always want to be prepared. So anytime there's a chance of splatter or body sprays, you want to have all that equipment readily available. And our second scenario You respond to a call for a patient at a skilled nursing facility who exhibits an altered mental status, fever, and weakness. And again, what are some considerations you might have? How are you going to protect yourself during this call? Okay, so here again, these symptoms could be caused by many different infections, including any type of infection to cause fever, such as pneumonia, UTI, or even general sepsis. Could this patient have an MDRO? Could this patient have that multi-drug resistant organism? Think of that probability. Was this patient on precautions when you picked the patient up? Did you see any colored posters outside of the patient's room? With altered mental status, you also want to keep in mind that this patient may not keep the mask on. They also could become combative or resistant to any care, especially if you're putting an IV in. You want to protect yourself while doing that. So precautions, you would use contact precautions. And also, again, with COVID-19 out there, you're still going to maintain COVID-19 precautions. And the PPE recommended would be gloves, mask, and a gown. And we have our last scenario coming up before wrapping up this course and going over key points. You receive a frantic 911 call from a mom that her 7-year-old child is having an asthma attack at home. Upon arrival, you see that the child is in respiratory distress and appears pretty ill. What are some of the considerations here, and how are you going to protect yourself? And in this case, so considerations, what appears like asthma, it could also be caused by a contagious infection, respiratory infection, right? It could be RSV, it could be the flu, or this child could even have COVID-19. So currently, as we all know, we're hearing it, and you definitely are seeing it, this tridemic's out there. So it could be any of those 3 prevalent contagious infections. RSV is not just a childhood illness. Remember, it is still highly contagious. What treatment options are available? Does this child require a nebulizer? I mean, if a neb is required, treatment at the scene, knowing how the nebulizer produces high number of respiratory particles, can you administer in a well-ventilated area? Do you have that option? Also, or could this med even be delivered via a metered dose inhaler, depending on how critical the patient is, right? What PPE offers the highest protection? Your N95 is recommended for this scenario as the highest level of protection for you as EMS workers. Eye protection, gloves, and gown. And precautions, they're going to be all of them. You're going to want to follow contact, droplet, airborne precautions, as well as COVID precautions. So that PPE would be gloves, and N95 or higher level, eye protection, and a gown. So here are the takeaways from this refresher. For germs to spread and cause infection, there must be those 5 elements present. There are 4 modes of transmission for infectious organisms, such as we went over: touch, splashes and sprays, breathed in, and clinical care. Always consider what type of transmission-based precautions may be needed for that patient. And obviously be prepared prior to that call, which all of you have been trained. This is a refresher for you. So I'm hoping that with this knowledge from today that you can take it and provide safe care for you and your patients, and helping decreasing the transmission of infection disease out there. I thank all of you. I'm going to have to see I see some of you who have been in my other classes and some new ones. So I thank you all for joining me. I really appreciate it. I thank you for what you do in the community. Before we move on to Q&A, I want to invite Karina back just to go over a few announcements.
Thank you so much, Lisa, for a great refresher for all of us. And if you want to be included in our updates via email, and you have not already, again, feel free to type your emails in the chat box, or you can send us an email directly. And we are also on social media. We announce our updates and new courses in social media as well. We have a website right here. We have self-directed courses. And of course, with our partner, Center for Emergency Medicine Services at the Rhode Island Department of Health, they have courses for EMS under the CDC train or under RIDO train as well. These are references for this training session. And at this point, I'd like to invite, please, on camera, Dr. Kearney, Eric, and Lisa to begin our Q&A. And to our attendees, you can raise your hand so you'll be unmuted and can speak directly, or you can type your questions in the Q&A box that is up right now. Thank you. For the panel, transmission pathway as clinical setting, expand, please. This is meant to ask about the clinical care pathway.
Yeah, so the clinical setting as a transmission pathway is essentially what we sometimes call nosocomial infections. So infections that may happen to a patient or they may contract because of something related to their medical care. For example, poor hand hygiene leading to medical staff member transmitting a C. diff infection from one patient to another patient due to the fact that they weren't washing their hands. An infection at a central line that was placed because there wasn't great hand hygiene ahead of time, and they didn't clean the skin well enough and use the antimicrobial disc around the central line. So it's really things that are part of your typical clinical care that result in breakdown in barriers of the skin that may lead to skin infections, or improper mask wearing that may lead to respiratory infections, and extends honestly through the whole realm of clinical care. This can include for patients who are in the ICU and have catheters, catheter-associated infections, central line associated infections, ventilator associated infections. So it really spans the gamut. It's just a kind of a catch-all box for infections that are related to the clinical care that the patient's receiving.
Have poppers fallen in disfavor when transporting respiratory related cases?
So the biggest challenge with PAPRs is the lack of availability. We just don't have many. And so when we have well-fitting N95 masks, whether it's the traditional green one that you may have seen that's kind of circular, or the duckbill one that fits quite well, as long as they are properly fitting and people are using the rest of their appropriate PPE, so eye protection, gowns, gloves, when all of those things are indicated, the traditional N95s, as we think about them, work just as well as the PAPRs. The challenge we have is the number of PAPRs available, the fact that a lot of them are quite warm and require batteries to be constantly charged. But sometimes, in the hospital setting, we would see individuals using PAPRs, particularly if they had a lot of facial hair and it was hard to get a good seal. But generally speaking, traditional N95s work just well.
Thank you, everybody, to our panel, Eric, Dr. Kearney, and Lisa, our trainer. Thank you for your time this afternoon. And thank you, everyone, for your participation. We had great questions, great turnout today, and I really appreciate you all. Before you log off, please take a few seconds to answer these 3 questions you are now seeing on your screen. And this is a feedback form. It will inform our team on how we did today and will help us improve. Thank you so much, everybody, and hope everybody has happy holidays.